Well, robots have made their way to the operating room now. New technology, the first of its kind in North Carolina, available right here in our area.
Yeah, it's used to treat spine disorders. And Carolina in the Morning's Caitlin Stansel live at Hanover Regional Medical Center with more details on this medical advancement and whether it might help you. Caitlin.
Kim and Bob, really this technology is focusing on patients with spinal disorders, feeling back pain and looking for relief. They're using Mazor robotics, a really exciting piece of new technology that is helping surgeons kind of map out the plan even before you get here into the operating room. I have Dr. Adam Brown here with me to kind of explain a little bit how you do plan in advance before you start the surgery.
Good morning. So this is basically a tremendous new resource we have that create a GPS of your spine. And the reason it's better than the previous technologies is that it registers each individual vertebra of the spine independently, whereas older technologies did one reference frame, and the farther you got away from that, the less accurate it was. So this is a tremendous new technology, and basically here's how it's done. The robot will give us this GPS, and then before the surgery we can plan each individual screw at each vertebra, both in an axial plane or a plane that cuts through the body this way, and also in a side view or a lateral plane. And it's extremely precise, less than 1 millimeter.
Wow, and we actually have some video of this surgery in progress, as well as some other video scenes there. But can you kind of talk about the recovery time for these patients and how long this surgery process is?
Well, it all depends on the actual operation and what that patient needs. If the patient needs, say, just 2 vertebrae to be fused, where we place 4 screws, the operation might take 30 minutes. If it's a condition of scoliosis where they might need 10 or 12 screws, obviously that's going to take longer. It may take a couple of hours, but the recovery time is still quite a bit less than it was with the open techniques or even the older techniques with this GPS type technology.
And you kind of just touched on this a little bit, but what kind of patient would really fit this type of surgery?
Any patient that needs a fusion or screws placed into the spine is a candidate for this. Most of that is degenerative disease of the spine. There are probably in the range of 3 to 5 million adult Americans who have this condition, and that number is continuing to rise as we live longer and want to be more active. But also fractures from car accidents or falls, infections, all of those people are candidates for this operation.
Wow. Now this technology, really the closest states that are using it right now are South Carolina and Virginia. And for the first time in North Carolina, new Hanover Regional Medical Center, the first one in our state to use this Mazor robotic system. Really exciting technology. We have all those details on our website, foxwilmington.com. You can go there now for that information, but also stay with us here on air. We're going to have more coming up in the next half hour. For now, back to you guys in the studio.